for having me on this beautiful webinar. I'm very happy to be here. Just let me share my screen and walk you through my presentation. There we go. Here we go. So maybe just a small introduction about myself. I'm Alexander Olbrechts. I work at Technology Federation Agoria. Within the Technology Federation, I am responsible for the healthcare branch and the healthcare companies. And for these companies, I mainly focus on everything that is data-driven healthcare, which contains obviously artificial intelligence and telemedicine. Furthermore, I have plenty of other activities, both of outside of those areas of expertise, but I tend to think those are my main axis, and that's the reason why I'm giving this presentation today together with the people from Agoria. The goal overall of this presentation is just to give you like a small hint of my vision on AI. It is fairly condensed what is in it. So feel free afterwards to reach out if you have any more questions. And we have a Q&A at the end, which I'm very much looking forward to. But let's dive in it. And I think the title here is already one of the key messages that I want to give, is that how you go from data to artificial intelligence. You don't necessarily need artificial intelligence to turn data into real information, especially within healthcare, which I think is very important. We're creating quite a lot of data at the moment, but we really need to capture that value that the data has. So let's go into it. But first, I know that the audience will already have a very good idea of what artificial intelligence is, but just to give you the taxonomy of how we at Agoria and myself look at it, is actually on these three basic layers. And you know, AI, it's a word, and I see this all the time with quite a lot of companies and congresses and now webinars that I visit, is that the word is being thrown around quite a lot, and if I mean a lot. And this is not the first time. I mean, it goes up and down in waves, and now we're back on another wave. And the question actually will be on how to captivate that new wave and how to really make it into reality as such. And because of that, I want to stress that AI is not something really new. It's been around since the 50s. And especially if we take the definition on what AI actually is how computer systems can think and solve problems independently. And really, if it all boils down to operating or executing tasks that would normally require human intelligence. And if you take that bubble, you can already imagine that quite a lot of things that we do today with the normal computer could be with the same category and be labeled as AI. But then if we go a little bit further, and then if we look more specifically into the 80s, we saw this new technology rising up, which was machine learning. And that is the statistical methods that were behind all of this to improve these kinds of experiences. And this was already a huge step forward, but the real acceleration that we are experiencing right now, it actually came in 2010 with computing with multi-layer neural networks, and these neural networks like mimicking the way on how our human brain actually works. And not only that, I mean, that already obviously accelerated quite a bit, but there are three other important drivers here. Big data, and that is, if you look to the left, I did a short research on the amount of data that's being produced for the moment, and you can clearly tell on this graph. I mean, our lives are dominated now by graphs and numbers, hence the COVID crisis. So we're all fairly familiar with this, and you can see this in this histogram that it just rapidly explodes. And if I think about an example, if you look at radiology, it used to be just these tiny bits of information, and now, I mean, dual source CT scans are producing a massive amount of data, and not only for what it's used, but it's all that is after this as well, that contains all of this sub-level information. The rise of cloud computing was another big driver, or is another big driver. It opens up the way on how we store data, and it really breaks the normal barriers on how we think about storing data. and bringing together lots of data, you can easily make the link to AI. And the last reason, it's the AI algorithms that are off the shelf available. So you don't need to have this wild expertise of a very high-end computer scientists to go on this. You can see that medical doctors and engineers and stuff, they have great ideas, and they can tweak existing software into building these new applications. And that is, I think, terrific. But that also explains why a lot of new companies, which I see every day with AI related matters and products arising. So I'm very, very happy to see this. And just to give you a small example on how AI is perceived within hospitals, for example. So in France, they did what they call the barometer of the maturity of AI within the French hospitals. You can see the results here. We actually did with AI for Belgium, a collective where I'm active as well. We launched the same, or more or less the same, questionnaire in Belgium. So, and we will be presenting the results tomorrow. So have a heads up for that. But we can work today with the French results, and here we can see that the French hospitals and with a more reach, we can say that the Belgian results will not differ too much, but that is that AI is really important for them. 4 out of 5 hospitals indicate that AI is important, and 3 out of 4 will say that AI is a strategic priority, and this already tells you that the strategic vision of hospitals will be hugely dominated by this, on how they will use and capture AI, the potential of AI. But that, and this is I wouldn't say the other side of the medal, but 85% indicates that they have difficulties or that they have a challenge on identifying that domain where AI will be the most beneficial. And on the right bottom half, you see another problem arising, and that is the lack of competence and expertise in AI. And you can already intuitively feel this difference. If you would say, let's say, a healthcare provider that is working on a very close basis with patients, and not necessarily dominated by data, is completely different than a healthcare provider that is active in, I'll take the same example as radiology. There is more of an affinity already with data. And this is already noticeable in today's practice. So the skills of people will have to change, and this will have to be implemented on all these levels to capture this. But these 4 numbers, in my opinion, give a good example on how AI will change, how it is a strategic importance, but on the other hand, that there are still some challenges still left there. Now, healthcare and AI is not only clinical support, which is the second point here. This is really sexy to talk about. These are the applications that end up in mainstream media. These are the ones that make people dream about AI and think about huge possibilities. And that is entirely true, but there are more applications than only clinical support applications. Therefore, I mean, the support and improvement of logistics and the organization is really important as well. Less sexy, I would say, but as important, if maybe even more important than clinical support applications. Planning new hospital departments, how to organize staff, how to really work and predict the workload that will be there. And finally, how can you use the materials as efficient as possible? Think about pharmacy stock to really work with that. And there, I think there's a lot of benefit and potential there for AI to really help and to lessen the administrative burden. Clinical applications, I mean, these speak for themselves. They help with diagnostics, they help with therapy, they help with follow-up, and they will condense this huge amounts of knowledge that the medical and scientific world already possesses. And this is really condensed down, and it could help, and it can be this assistant of medical doctors and healthcare providers in message. As a third field, and it goes a little bit together with the fourth area, I would say, but this is research and development. Digital twin research, for example. If you can imagine that you need something new, like I would say heart, for example, you can already test therapies on digital twin heart. This sounds like science fiction, but this is actually stuff that's being developed. And then fourth is the battle against COVID. Of course, we used, would say we, but AI has been used in the battle against COVID. Think about the support diagnostically again, the epidemiology as well, and finally the development of vaccinations. Now, if we look, and here we fall back to the report of the EY study that has been done in France. If you look at, if you ask hospitals in what domain AI will develop the most, then we see research. This is fairly obvious. And then the quality of care, and with quality of care together with the management and anticipation of flows and the performance of these administrative and logistical processes can mean in return that time will free up again for the healthcare provider that can be reinvested in the patients. And I think that is the beauty of how AI can help tackle the problems that are, especially today in this pandemic, especially today, that how can AI can support all of this. Of course, there are obstacles as well with AI. I already mentioned the lack of skills and expertise of this. So we really need to be aware of that. You can't just push technology and expect people just to follow. No. They have to be educated on this, and this digital transformation and the skills of people will be necessary in order to capture the full potential of AI. And it will be one of the speed determining steps, I would say, in the adoption. Finally, another problem is the data governance and data quality. Yes, we do produce quite a huge amounts of data, but the quality itself can be an issue, especially if you go back quite a while in time, and the governance too, if you want to use data for a specific purpose. But we need to be sure that the methodology that is behind all of this is the good one. So how will you direct the flows of data, who will have access to what, and so forth. And then we cannot forget as well the voice of the patients here, who is finally plays a really important role in what will be done with his or her data. And a last point, and this is a bit towards the companies as well, is the lack of information of all the AI solutions on the market. I remember the days that people asked me if a company I used to work for, if we did AI, just with a yes or no question, whilst the whole portfolio was available. So this is something that you need to be aware as well, that this communication needs to be there as well, for the smaller companies, bigger companies. Now, if we look at the different risks that we see with AI, that is, if we ask them and how they will perceive all of this, is there are fears and there are risks connected to using AI. New psychosocial risks, for example, that can arise due to the use of AI. We can see that people tend to be afraid on losing jobs due to AI, or seeing the content of their job change dramatically, and that can scare people. It can also lead to dehumanization of the whole work and the social ties that people have within healthcare. I mean, people that go into healthcare are choosing this due to the fact with the interaction that they have with people. This is a warm profession, so this is of course something that is identified as a risk. And finally, new work accidents and diseases that could arise of using this new technology. I mean, this is fairly abstract, I would say, but this certainly has something of a truth behind it. Now, I spoke about the ethical issue, and just to give a small example, which I find really interesting, because it shows you that ethics isn't the same everywhere in the world, and this has a big impact on how we think about AI. And this is this particular problem. Now, if we would develop a self-driving car, I know this has nothing to do with healthcare, but just bear with me. But if you have a self-driving car and people tend to cross the road, we can see on the left-hand side of the crossroads little children, on the right-hand side elderly people. Now, we have to program the car to take a decision here. This is an example, right? There are many variables, but just bear with me on this one. What choice will it make? how will we look at this choice? Well, research will tell you that this has a cultural component, meaning that we are in the Western world of Europe, we tend to think about going or steering the car into the direction of the elderly people. Whereas in the Eastern countries, we can see the difference, the other way around, due to the fact that they think others, they have another collection on how AI, how ethics work and how they perceive their elderly. They will steer the car towards the little children. Just to give you this idea, and this means, this is a very exaggerated idea, but it gives you an idea on how AI and ethics function differently in different parts of the world. Now, to more or less conclude here, there are quite a lot of opportunities. I mean, for AI within healthcare, we can think about faster diagnosis, newer therapies, a reliable prognosis, because many times it's different to predict the future. And this would be one of the areas. Think about personalized medicine, predicting medicine, preventive medicine, anticipate the new pandemics to be really fancy in the world of today, and decreases administrative burden, giving back time to the patient on the bedside, and more intelligent organization. On the other hand, we have, of course, the challenges that I talked about, is data accessibility, the transparency of data, and the decisions that it takes. I only touched this, but this is an important part. That is how the system came to this decision, and the sustainable financing that it needs as well, because it's bound to that in the second time too, and an adequate governance. Now, if I conclude what AI can do, I think one of the biggest messages here is that we have to take is AI will not replace healthcare providers. This is something that I read and it annoys me. It will assist, and we need to control this technology, and it will have huge benefits. It will not replace us as healthcare providers. It will be an extra tool, I would say. It will also transform the role of a healthcare provider with more of a managerial focus, due to the fact that we'll be able to manage more patients, more pathology, more complex pathology, because we have this very smart assistant just next to us or on a finger click away. It has massive opportunities, and at the same time, it has massive challenges. And the education, as we saw, will be very important. But the patient itself, we can never forget those. The patient will play an important role as well in this, and how they will be the new patient within this new world of healthcare, as I envision it here with AI. I think that is my presentation or my time for today. So I'm happy to give the word back to Kristien, and thank you for the attention.
As you might have already seen, Vanessa asked a question in the chat, so feel free to already respond to that, or otherwise we can take that in our discussion at the end. Yeah, I think in your presentation you touched on some really important obstacles like ethics and data protection, and on the other hand, you also showed that there is definitely a need and an interest from healthcare providers to leverage new technologies. So yeah, from the perspective of a technology provider, we also believe that we have an important role to educate organizations on AI, how to use it, how it is built, and to collaborate with experts to bring value in their domain. So for example, in healthcare. So today, I want to especially look at AI from the patient's perspective. I will start sharing my screen because I also have a presentation. Just a second. And with that, you should normally be able to see my screen. Yeah, I'll introduce myself quickly and then I'll dive into some trends and some use cases. So my name is Kristien and I work as a client partner at Radix. In that role, I help clients get started with their AI projects, and I make sure that our project team can deliver high quality solutions. What we do at Radix, we believe in AI for superpowering people. We want to build AI solutions that help our clients grow, help employees do more meaningful work, and help people improve their lives. We do that in 3 ways. Through delivering AI projects, but also through identifying AI opportunities and through training and coaching. When we think about AI in a healthcare context, and actually this is the same in, for example, HR or in public services, we see AI in the role of as a co-pilot. So where the user is in the driver's seat and the AI solution supports their decisions and supports their actions. A second element of what we stand for at Radix is creating tangible impact with AI. So building solutions that users understand, trust, and love to use as well. Trust is a really important issue when it comes to AI in health. Alexander already discussed this as well. And I found an interesting study by Accenture last year, where it turned out that the feelings around about digital health solutions in general and about AI for health specifically are still very mixed. On one side, people see a lot of benefits in using digital solutions that are highly accessible and that offer the opportunity to provide personalized insights that allow to save time and effort, for example, in setting up appointments. But at the same time, the trust is still an issue that's largely at play. So, for example, the study mentioned that there is a huge difference between the trust that users have, that patients have, when the solution is built by a healthcare provider, where about 80% of users report feeling very confident in using this solution. While on the other hand, if the solution is coming from a technology company or from the government, this percentage drops down to 30 or 40%. So this is a massive difference. Let's now have a quick look at the journey of a patient who starts experiencing symptoms, wondering what they need to do, and deciding whether they need to ask for advice from a medical professional. On this journey, we see different places where the patient feels like they need additional support, whether it is to lower the barrier of seeking help, setting up an appointment, adapting to their new normal. I know this is a term that we're well used to by now. So adapting to the new normal of what their diagnosis means, what kind of treatment plan should they follow, what kind of lifestyle changes should they take. Also for family members, what can they expect and what can they do to help. So there are different challenges that we see here. So different questions that we believe that AI has the opportunity to help and make the patient feel more at ease, more comfortable in their situation. And especially with COVID, we see that people have become even more hungry for information than they had already been in the past few years. Health has become a really important topic, and the uncertainty that we're experiencing at the moment means that people need to get control, get grip on the situation that we are living in. So patients are taking on a more active role, which is why the concept of healthcare consumers is popping up more and more. So they start to expect in healthcare the same experiences, the same conveniences that they, for example, see in retail or in hospitality. So today I collected 3 trends, as well as some examples of use cases, AI use cases that can answer these trends. Each of these use cases is aimed at giving the patients the tools that they need to feel informed, to feel at ease, and to manage their own health. So, for example, the first one, making reliable information more accessible to patients. How can we make sure that every patient has access to the information that they need without getting overwhelmed and without the risk of getting misinformed as well? So on this topic, we could look at techniques like question answering, summarization. Text simplification is also an important one here, to decode the medical jargon so that patients can understand more easily what a certain diagnosis or a certain treatment means. Second trend that we see is about simplifying the steps that it takes to receive help. So by giving solutions in the hands of the patients that allow them to make appointments more easily, reschedule their appointments or get reminders. So here the classical example would be to use, for example, a chatbot solution. And then a third trend that we also see is around humanizing and personalizing the virtual care experience. So when working with virtual assistants, and especially in the healthcare context, but actually it's true in other contexts as well, empathy and thoughtful and appropriate reactions become really important. And this is a topic that's also called algorithmic empathy. There has been some really great research going on in the past few years. Let's take a look at some examples. So the first example that I found that really spoke to these trends comes from a hospital group in New York. They actually launched a chatbot to help patients, to help remind patients about their colonoscopy appointments. And they built this specific solution because they noticed that about 40% of patients don't actually follow through with their appointment because they find it so intimidating. So they decided to build a virtual assistant that serves multiple goals. The first one, to improve health literacy by helping patients understand the procedure better, why it is important, and why they should undergo it at this moment. So using AI, we can make information on the procedure accessible, also in a way that is short, to the point, and mostly that looks very familiar. So by using this format that's very similar to a text message, this is a format that we are used to communicating in on a daily basis. So if we can provide information on this procedure in the same way, then at least the context is already familiar to the user. The second trend that we see is, or the second trend that we see coming back in this specific use case is reminding the patient of their appointment. So sending a reminder at the right time of where they need to be, what they need to prepare for their procedure. And to make it even smarter, you could, for example, use the previous behavior of the user to find out when would be the best time to send such a reminder so that it has the most effect. And then the third trend we also see coming back in this same solution, because from the conversation that the user has with the virtual assistant, we could detect whether the person is feeling concerned or anxious or maybe even annoyed because they get this message, and then give the answer that is the most appropriate for this context. So yeah, as you can see in the previous example, even though it is one solution, there are actually multiple models that underlie this one solution, and that in combination create this great impact of helping the patient feel more at ease, more in control of their situation. And because they are more likely to actually attend their appointment, they are also improving their health outcomes. And then a second example that I found and that I really liked came from a company called Abridge. This is a company in the US that was founded by medical doctors who saw that this need in their own practice. So the problem that they faced is that there is an overload of information in one doctor's consultation. So for example, different medical terms that are mentioned, lifestyle recommendations that they share, treatment options that they discuss with the patient. And what they find is that the patients really struggle to remember all these details. So that also leads to an increased amount of anxiety in the patient, a drop in adherence to the treatments. So what they did was they built an application that uses speech to text to transcribe the conversation. So transcribe it into a report that the patient can read back later on. They also highlight key elements in this conversation that the patient should really remember. So for example, keywords related to the medications, to the treatments. And then how they also supplemented this was to add a decoder of the medical jargon. So any of the more complicated terms also receive a an explanation or a definition that will help them understand their situation better. So again, this is an AI solution that really builds up the confidence in the patients, makes them better informed, and also allows the doctor and the patient focus on this human side of the conversation. So again, a solution that is really a co-pilot to help humans be more human in their day-to-day lives. I'd really love to hear what you think of such solutions. So feel free to provide your feedback. I believe my colleague Julia will also share a poll for this. Feel free to also type it in the chat, and we can also move on to a discussion soon. Actually, before we move on to the Q&A, I want to thank you for participating in the webinar. So if you're interested, we're happy to offer you a free consultation in the coming weeks to discuss any questions that you might still have. My colleague will also paste some links in the chat for you to check out, like the link to our website where you can see some of our showcases of our work, as well as a link to my calendar if you already want to book your appointment. And of course, after the webinar, we will also reach out to you with the links and with the recording of the session. So with that, we're happy to take some questions now.
The chat of Vanessa Rivera, and then the last name, I'm not going to take the risk and not pronouncing your name correct, but do you have any comments on what people are thinking to address the lack of skills and expertise, or who should be the training be aimed at? I think on all levels that this education should be going to, due to the fact that AI is not necessarily a responsibility of just one person in the entire healthcare trajectory or the healthcare pathway, whatever you want to call it. So I think this needs to be aimed at all relevant chains within this link, and how we can do this. I think this is a multi-layer approach as well. You cannot change the entire system of education from today and tomorrow. I think it's more a fact that webinars like this one, webinars more specifically on for healthcare providers, small time initiatives, and those can grow and go to bigger ones. At the same time, I think there are quite a lot of initiatives and official ways on how healthcare providers should get their education right, and even legally defined. And I think there we can aim on changing that a tiny bit and include digital solutions and hence AI solutions. I think that is really important, and on all levels with all the tools that you can get. It does not stop and just changing the education of a doctor or a nurse or whatever. We're just implementing 3 hours a week or points or whatever the system is going through now, but in their education, and that will be sufficient. No, this is changing all the time, and this needs to be implemented, and it's a lifelong learning trajectory. And I think the people that are now a tiny bit younger and then that will start these kind of courses, they will be even more familiar with digital tools. So I think that is my response, if that answers the question to your question, Vanessa. We have a positive answer in the chat, so that makes me quite happy.
Mm-hmm. So I also see the comment from Ranjiv. I hope I'm pronouncing that right. So I believe AI and ML should be used as a decision support tool. So yeah, exactly. So we really believe in AI in this co-pilot role, not in the role of making the decisions instead of the human. So definitely in a healthcare context, this is very sensitive. So yeah, I'm very much in favor of. I'm a fan of AI, so of course I say that I'm very much in favor of giving an AI solution in the hands in the hands of a medical professional or in the hands of a patient, but always with the caution of this is a support tool and not the decision maker itself.
But I think it's the role of managing this new technology, or at least new, and managing this technology and using it to our liking. It's no need that it should. We shouldn't think about the Terminator scenarios. I think with AI, of course, legislation and that stuff needs to be well done. And I saw that Danny van der Rooyen is in the webinar as well. So we are collaborating on that, I think, and he in particular is doing a great job on that. But this is necessary as well. But AI, there are multiple examples within healthcare long before there was even talks about data, and we saw the same change on how new technology or a new way of handling problems changed the world of healthcare. And at first there was a lot of skepticism, and afterwards it became the standard operations. So this is something to take into account in this as well, and the change as well of a new technology. You know it's going to change the world in which it's active. For example, the mobile phone. We all knew that it was going to make a change on the way the world worked. We never could have imagined so many years back that it would be the mobile internet that really did it, together with the camera. So this, again, with AI, we have the same question. We know it's going to change, but we don't know how much and in what direction. We can only hint to this.
To come in. So let me first address the one from Julie, which is around the fact that not a lot of hospitals have budget for innovation. So that actually is a barrier to start building solutions that can be adopted by patients. So yeah, I guess this is a kind of chicken and egg problem as well. So first of all, there needs to be some awareness, enthusiasm for patients that will actually adopt this solution. So yeah, I would say with any AI solution, if the budget isn't confirmed yet, start small, start with something that can immediately generate a lot of impact. Also work closely together with maybe innovators from the medical space, like medical professionals who also have this interest or this experience in AI. So I would say that's a good place to start. Maybe Alexander, do you have some other recommendations?
Yeah, absolutely. I think the financial system within Belgium is, wouldn't say up to date to new technology as such. There is a bit of a paradoxical system in how things are getting financed in hospitals, and the emergence of new technologies that make efficiency better, that make the healthcare more efficiency. I would think there's a bridge. We need to solve that bridge, and that's really fundamental work. But I wouldn't rely only on that. I think AI companies and companies that are active with data and efficiency and quality of care solutions within hospitals, there is a business model aside that, and the financing of hospitals is really important. But to be successful, I always tell companies to have another way of financing itself by adding value somewhere else, whilst waiting for a new change within the healthcare financing solution. So this is one point, and I do agree with you, Kristien, that there's a chicken and egg problem as well. And I think there another opportunity lies for the people that want to push this technology is to change the idea that AI is a cost, it's an investment. And it's not on this quarter you will see the results of your investment, of any investment. You see it really quickly. It will take a bit of time, but once it will be there, and you give it its time, it will come. This return on investment, that is for sure. I see one question on from Marco Menabrito of the results of my data. Yes, it will be published tomorrow during a webinar you can register there on the website of the specialist or le specialist, depending if you're French or a Dutch native speaker. But tomorrow we will launch the results of our Belgian AI barometer. That will be very exciting to see as well. So, and the French one is the data that I showed is downloadable, I think, on the internet, if that is the question. I think above that, Kristien, there's a question for you from Pascal van de Hucht.
So how is Radix connected with healthcare ecosystem players to unlock the power of data, or does the data need to come from the customer? So typically when we do projects, we sit together with our client to identify the data sources. So it could be that the client that we're working with as a company already has some very valuable data sources, but we see very often also that the data isn't complete yet. So what we then go look for are open source data sets. Sometimes we even foresee, depending on what the task is, annotation tasks. So where human annotators come in to label certain pieces of data. So for example, for a sentiment analysis project, we did that recently, where we invited some annotators to create additional data for us. I'm not sure if that answers your question, Pascal.
In the meantime, I can take the one below that question whilst Pascal is typing, maybe yes or no. Wait, I'm just looking for the next one. The co-pilot way to go, would it be enough to avoid regulatory barriers related to a clinical medical device? I think we go see Danny, hi again. You guys have published a paper on how AI and the MDR are currently related to each other. I would definitely give that a read towards that. I think that will be a very elaborate answer to your question, because this is a multifaceted question that is difficult to answer just on the spot like this. Yes, there are very much regulatory issues there, and the way on how medical devices work today. And I would refer to that document. It's really interesting to read, and it will give you the full scope of that. In the end, I think we can safely say that people will still be responsible as well on how they use this AI, how far they let it go, and it's used in the best interest, I think, of all doctors or healthcare providers as such, to give a bit of a political answer on this one. Any suggestions to tackle the ethical issues in adopting AI in healthcare? Yes and no. I mean, we are building, and not only we, I think, within the entire ecosystem, there are initiatives on how AI and ethical problems can be solved, or at least be discussed in an open way without the barriers, and where cultural differences are trying to be middled out, I would say. So you have to be aware of these problems when developing AI tools and AI solutions. If you know that your solution will be available worldwide, then you know that this is something you have to take care about. And if it's only local, you know that it's only local. But I know of Dennis Data Centrum Kennis en Maatschappij, or the Data Knowledge Center, is working on AI blind spots, where I'm part of as well, where we look at the potential blind spots that you can have with AI and the ethical issues there. And then we have my colleague Jelle Hoedemakers with Agoria that is focusing on this issue as well. So yes, this is an extremely important issue due to the fact that AI and ethics will always go hand in hand. If you translate that to a healthcare environment, you triple or quadruple the effect of this due to the fact that it concerns about people. If I look at my colleagues within Agoria that are concerned about manufacturing lines, and an AI system is telling them to do X or Y or Z, and they will triple their efficiency, well, they will probably do it. The only thing that can go wrong is a production line. If we have this, if we would have the same mentality, well, the cost could be quite high. So we tend to be rather careful here, which is the most logical and good approach. So that explains why it's so important to take ethics always in the idea of AI in healthcare.
Yeah, and if I can add on that, on Simona's question as well, from Radix perspective. So when we do a project with a client, we also like to involve a user experience expert who can think together with the client, how will this solution be used? What should the decision of the model look like? So, for example, we did this in the context of job matching. So, what kind of representation of the match between a candidate and a job should we put forward? Should we include, for example, a percentage of matching? Should we make the match explained? So make it clear why a certain match was made. So actually, in every context, we have these discussions with our clients to make sure that the decisions that come from the model are also properly explained and are properly addressed to avoid any issues going forward.
I think we answered quite a lot of questions now already. Oh, there's a new one. How many? That is a question for you, Kristien.
Which question are you referring to?
How many models do you normally build for a specific project? From Marco.
Well, that's difficult to say. It really depends what the project is. But do you mean models in the sense of different AI components that are in one project, or are you talking really about the model specifically? So for one AI task. So I'm assuming that the correct refers to the first part of what I said. So yeah, depending on the context or of the use case, it might be that there are multiple AI elements. So for example, in the use case that I presented earlier around the colonoscopy virtual assistant, actually there were multiple, or they involve multiple AI techniques, multiple models. So it really depends on the use case, what you need exactly. So it's generally not one AI solution to one problem, but it's often a combination of multiple elements. Actually, I think we also skipped a few questions. There's a question from Ranjiv on what are your thoughts of an AI ML IRB? I'm not actually sure what the abbreviation IRB means.
I have the question here. If Ranjit, could you specify the IRB, please? There he is. Institutional Review Board. If you mean a board within a hospital that would think about AI and machine learning, or because the question is not entirely clear to me. Vanessa is giving us some more info. There we go. Marco has an answer. What may be something that is a link to this question on the total governance of AI and the okay, I think the ethical considerations, we talked quite a bit now on the ethical part. It's, if we look at the level where I would say of the hospital itself or the network, if we talk about Belgium itself, I think there we need some guidance and innovation managers, I would say, to really push these kinds of technologies and go into the direction where the hesitation about going forward with these new technologies is getting quite important on a governmental level. So I think that would truly help already in the local governance or the local implementation, at least, of AI. quite stuff going on about the ethical side of things. Well, it's inherently that indeed you have to build quite a lot of models to correct for this these unwanted effects, I would say. And I follow Marco on his comment there. Furthermore, we have to make the difference between what is actually commercially available AI and the one that is still under development. And there you have to be well aware on what problem that you tackle at what point. Okay. I think we have a quite fruitful discussion in the chat as well, so we might leave him to him. Okay, I think
from Felix earlier, any tips for finding good AI partners? I would say, yeah, finding the right partner that fits what you're looking for specifically. That's a very personal decision. So definitely have a look at events that are being organized. I know that Agoria, for example, where Alexander is from, also regularly organizes events. So that's a good way to be aware of what is happening. So this is specifically for Belgium, but I'm sure other countries have similar organizations. So look at what's happening in AI in a specific country. I would say those organizations are a good way to start. And finding what resonates with you, like what talks resonate with you, what kind of who as a person resonates with you. I think that's the most important one in identifying who would be a good partner for your project.
To add on that, yeah, I mean, you have to identify your problem as well that you want to tackle with AI, or what your digital transformation on what process would be. Identify the partners there, try to find your way towards those partners, identify them well, identify the way how you can reach them. And once you've done that, you can do that by doing events or reaching out to them and stuff. But I think with every digitalization project where you're in the look for partner, where you're looking for partners, is making good field research, looking who is available and who does what, and then, as Kristien mentioned, where you have the best fit with your problem, and of course you have the personal relationship that is important as well. So there we go. That was my 2 cents.
I think the questions have also slowed down a bit. So thank you, Julia, for also sharing the recap, so sharing the links. So if you think of any questions after this webinar, either for me or for Alexander, feel free to reach out to us, and we can set up another call to address your questions. And if not, I wish you a nice Friday afternoon, and hope to see you again soon at one of our other events.
Thank you for the invitation.